FDA. We are eligible to receive over 100,000 doses this week of Moderna vaccine, and we are in the process of allocating these doses to hospitals and health systems across the state. Because Moderna vaccine only requires standard freezer temperatures, these doses will be shipped directly to providers. Our first doses are expected to arrive today. I've spoken before about what a monumental undertaking this vaccination effort is across local, tribal, state, and federal systems. We are all learning together through this first week of vaccine distribution and delivery. And we've made great progress. As of this morning, the Wisconsin Immunization Registry reports that 10,358 doses have been administered to people in nearly every Wisconsin county. We are working to be sure that every hospital has vaccine on its way this week. After the holidays, we will be expanding distribution more broadly to community-based providers as well. As we've learned together in this first week, we are responding to new information, such as providing guidance to our providers for treatment of allergic reactions and providing customized training for each of these two vaccines. And we are also refining our own state processes, including ways to better communicate with vaccinators and improving our system to get vaccinators enrolled in the program. Providers across our state have begun vaccinating their frontline healthcare workers, and we continue to hear stories from them about the deep well of emotion that these workers feel during this process. I can understand why. All of our healthcare providers, from nurses to doctors to respiratory therapists to nursing assistants and others, have been witness to so much pain in the past few months. As someone who has been a nurse at the bedside in a hospital, who has stood by and held the hands of patients going through pain, I know how hard these jobs are on a day-by-day and night-by-night basis. But just add in a pandemic, how much more pain these healthcare workers have seen, how much more heartache they have felt caring for patients with COVID dying alone. And I can understand the sense of a weight being lifted with the rollout of COVID-19 vaccine. I know all of us at DHS and everyone involved in the COVID-19 response across the state are grateful we have reached this point where we've been able to start getting the vaccine to these healthcare workers. And we're working very hard this week to get it to many more. And finally, as we begin the vaccine journey, let's all remember that we are still in the midst of this pandemic. Our state's disease activity is still at very high levels, and we need you to continue to stay home, limit your social interactions, and when you must leave your home, wear a mask, physically distance, and wash your hands. Thank you, and I'll hand it back to Elizabeth so we can answer your questions.
Thank you, Deputy Secretary. We will now take your questions, but a reminder, to maintain audio quality, please remain muted until it's time to ask your question. If you're on the phone and you're able to do so, use *6 to mute and to unmute. And we will begin with Adam Rogan of the Journal-Times in Racine.
Hi, thanks for taking this call. Can you said that the first groups will be the first groups outside of those in nursing homes and in healthcare providers will be able to get the vaccine after the holidays. Can you define, is that like after Christmas or is it January? Can you kind of give a time frame for that? And then also, the federal government suggested those next groups be essential workers and those who are 75 and older. Is that the plan for who's going to be vaccinated next in Wisconsin?
Yeah. Let me clarify, Adam. We'll be giving vaccine to community-based providers to administer to healthcare workers and to people living in long-term care. We will not be ready yet to begin moving beyond this first group of people, what we call phase 1A. We're going to still need several weeks and months to get through all of the healthcare workers and the long-term care residents in our state. But you are correct that the Advisory Committee on Immunization Practice has talked about who does come next, who's in the group 1B group. That will happen later this winter, not right after the holidays. Let me be very clear, later this winter or early spring, depending on how long this all takes us. And they have recommended that that be frontline workers, and people who are older than age 75. So we'll be working both to learn more from the federal committee on their definition of frontline workers. And just like we did with phase 1A, we'll be working with our state disaster medical advisory committee to further provide criteria and guidance on who the frontline workers are who will be next in line to receive vaccine.
Thank you. The next question to Katrina Nickel, WLUK in Green Bay.
Hi there. So thanks for doing this. My question is, we know ThedaCare here in the Fox Cities has not received any doses, that is, of the Pfizer vaccine yet. So we were wondering what exactly is what in the process is taking some healthcare systems longer than others to get the vaccine? And do you know how many systems that have not yet received any of the vaccines?
So the process for enrolling and being certified as a provider is a rather long and complex one with many requirements of the federal government and a lot of making sure everything we have in all of our data systems is really clean, because this data is what is necessary in order to get the vaccine to the right place in the health system. And again, as we've talked about, this vaccine is very fragile. It has to be stored in a very specific way. And so we've had to work with our health systems to be sure we understand exactly, which address, which loading dock, which person to call if the delivery truck pulls up and no one's there. So that's essential because we cannot waste vaccine. So we've made huge progress in moving forward all of our health and hospital systems through that system over the last few days. And as I said, we'll be getting vaccine out across our health and hospital systems this week, including ThedaCare.
Thank you for that. Let's go now to Rob Sussman, WTAQ in Green Bay. Rob Sussman.
Hi, thanks for taking my question. I wanted a little bit of clarification on the additional doses of the Pfizer vaccine. I know that the state was set to get 50,000 of them. That was kind of dipped off by the federal government. You had spoken about getting the 30-some-odd thousand additional doses. Is that additional doses, or is that just cumulative since the approval of the vaccine? Thank you.
The 35,100 are additional new doses. So we received 49,725 last week, and this will be an additional 35,100. And we've heard that that will be the level for at least the next few weeks. And sometime after the first of the year, the federal government will revisit this and give us better estimates of how much Pfizer vaccine and how much Moderna vaccine we'll receive moving forward each week.
All right, the next question to Shemaine Mills, Wisconsin Public Radio. Shemaine Mills. *6 will mute and unmute your phone.
Hello. Sorry about that. Can you talk a little bit about the facility in West Dallas and how that's being used for antibody treatment?
Absolutely. So our alternate care facility is, I believe, what you're referring to, Shemaine. And that is the facility at State Fair Park that has been providing care to people with COVID infection who are at a more stable point in their care and can be transferred there from hospitals. And so that's been the primary role at the alternate care facility to date. But beginning tomorrow, we are going to open up another section of the alternate care facility for people who are eligible for the monoclonal antibody treatment. This is an infusion, a drug that's given through an intravenous solution. It takes about an hour to drip into your body, and it is given early. Is if you think about where you would go to get this type of infusion, many people would go to an infusion center and in a local hospital. And infusion, we have some challenges with mixing people who are actively infected with COVID-19 with people in an infusion center who are not currently infected with COVID-19. You don't want to put them in the same room together. And so this is an opportunity to create one space in the state where physicians can refer people to the infusion center at the alternate care facility, and we can do that treatment there. Because at the alternate care facility, you know, the other patients there already are infected with COVID, and so it's not a risk to them. So we're really excited about being able to add this as a service of the alternate care facility and provide that additional resource to people in the Milwaukee and surrounding communities.
Do you know how many?
Thank you for that. We're going to go now. We'll try to get back to you on that one, Shemaine, but we do only have time for one question per reporter. So we do appreciate the question, but we're going now to Christine Flores at CBS 58 in Milwaukee. Christine.
Hey there, can you guys hear me?
Yes.
So here we are a week out from, when the first doses were administered. Can you guys talk about what are some of those challenges that you guys have seen within this first week? How did you guys go about them? And how is that setting the ground moving forward for the other stages of administering the vaccine or even the Moderna vaccine?
That's a great question. I mean, I think one of the challenges, to be clear, is the one we've talked about is getting people through our enrollment system. And we've made a number of changes to be able to hopefully move people through faster, both within our systems and adding more people to that. So that's one. A second, I think, is we're all learning about, there is just so much information needed to help vaccinators understand what they're supposed to do, for the distribution system, for patients. And so continuing to work on ways we can best communicate to all parties about this is an important thing that we've learned about. I think another important piece is how we think about planning moving forward. And how we learn from these first few weeks about what's working well, and how we start to think about, right now, almost all of the vaccination is happening in hospitals and health systems. As I mentioned, as we move in the first of the year, we're anticipating many of our local health departments coming on board and going out to immunize people in this group who may not be in the kind of controlled setting like a hospital or a healthcare system. So helping them know how to do this safely, for example, in assisted living, or if you're going to the fire station to immunize EMS staff there, or if you're going into a small clinic to make sure we have everything to do vaccination very safely. So those are a few of the lessons and areas we've learned about this week and are working to make improvements. And I know there will be more as we move forward.
Thank you for that. And the next question goes to Eric Gunn, Wisconsin Examiner.
Hi, thank you for taking this question. First of all, a point of clarification. It sounds like the current thinking about prioritizing teachers and other school employees for the vaccine is still somewhat in flux, and including whether they're in the category of frontline essential workers. So as a premise to my question, please clarify that. But the question is, if that is the case, then until teachers and school employees are able to be vaccinated, how safe is it going to be to return to broad scale, widespread in-person school learning in communities where community spread is still fairly high?
Tom, would you like to respond to that? And then
Sure. What I can say is there's always going to be a risk if they are not vaccinated, especially as you mentioned, if they're at high activity. I know a lot of schools are going to semi-virtual or virtual. The ones that are not are really doing the best they can for social distancing, keeping the masks on. But as we get the younger children in the classroom, it's harder and harder for compliance. So there's always going to be that extra risk if they are not vaccinated until such a time that the community levels go down to the point where in the green or low area.
Yep. And I think, Eric, in terms of teachers in the 1B category, as I mentioned earlier, we're talking about frontline workers, and we'll need to be defining those categories further. And so we're having those kind of conversations right now so that we are prepared for 1B as we reach the end of 1A. Again, at the rate we're getting vaccine right now, it's going to take us several months to get through everybody in category 1A. However, we want to be prepared for category 1B because these are not hard stops. It's not like we have to vaccinate every single healthcare worker before we'll be ready to start on vaccinating people in the 1B group. So that's why we're having these conversations now. We're always going to be looking ahead to the next phase, and within our state, we'll be making a lot more decisions about the specificity of who is in those frontline worker groups in early January.
Wonderful, thank you. We go now to Sean Kirkby, Wisconsin Health News.
Hi, thanks for holding this. Just was wondering, for the Moderna vaccine that's heading to the state this week, how much of that is being held in reserve for nursing homes? And for the remaining, when is it arriving in the state? Thank you.
Yep, great question, Sean. As you remember, we had made the decision last week to initiate the pharmacy program for Part A for vaccination of skilled nursing facilities beginning, and that is anticipated to begin next week, beginning the week of December 28th. So we are using Moderna vaccine for that, and we had to hold back the first 50% of doses for that program, and that's 29,000 doses. So that still leaves us with nearly 70,000 doses to provide to hospitals, health systems throughout the state. And as I mentioned, that vaccine will be arriving at various times. There's some arriving today. We just put in an order for others that we anticipate, per what the federal government has told us, will arrive tomorrow. We'll be putting in further orders for vaccine that will arrive on Wednesday. So it's a rotating distribution process. We find out what people need, we put it into the system, and it delivers then within the next few days. So this is different than what we've all come to be accustomed to with Pfizer, which is where a big truck comes and brings us 10 or 11,000 doses to a specific site that we then redistribute. With Moderna, it's a smaller and more regular cadence of vaccine coming into the state.
Thank you. The next question to Sophie Carson, USA Today Network in Wisconsin.
Hi there. Thanks for taking my call. My question is about the Elm Grove School Sisters of Notre Dame, where there were 8 deaths of nuns in less than a week. So it's not a skilled nursing facility, so it doesn't expect to receive the vaccine soon like the other nursing homes. Is there a possibility the vaccine can be made available for those types of facilities that provide care to elderly nuns?
Yes. And again, this is where after we've gotten a big bolus of our frontline healthcare workers, we'll be looking at distributing, as I mentioned, to a broader group of more community-based settings. And that would be a great example, Sophie. The pharmacy program that I just mentioned, Part A, focuses on skilled nursing facilities, what most of us often refer to as a nursing home. Part B of that program focuses on assisted living facilities. And so that includes community-based residential facilities, adult family homes, and a whole variety of these residential apartment complexes for elderly folks. So many more settings throughout our state, similar to the one that you've described, will be eligible under that Part B. We don't have a timeline yet for when we'll be initiating that, but I would anticipate, again, it will be within the next few weeks. But again, we have to know where we're at with vaccine coming from the federal government in order to know we have enough vaccine in the bank to turn the on switch on Part B and begin that part of the program. And those facilities will be receiving vaccine, again, through the same federal system of Walgreens and CVS being the federal partners to provide vaccine to those type of facilities.
Thank you. The next question to Brittany Schmidt, Action 2 in Green Bay. Brittany.
Hi, my question is kind of two parts. So first of all, with the Moderna vaccine, I know when we got the Pfizer vaccine and it went to 8 hubs, how many different facilities are expecting the Moderna vaccine this week? And then I know that we've seen reports of some facilities being able to use a little bit left in the vial for an additional dose. I'm wondering if we've had any wasted doses here in Wisconsin. And then just the Pfizer vaccine and the Moderna vaccine, the mRNA, but people really probably won't get a choice between either one. It'll be whichever is available to them at that time, correct?
That's correct. Your choice of vaccine is going to be largely driven by the vaccine that is available to your provider at the time. So I don't have the exact number of places that will be getting the Moderna vaccine. I think we're in the range of 25 or so that are already in the pipeline. And as I said, we're continuing to order, and there'll be more and more going into that pipeline throughout the week. The second question about doses, that is related to the Pfizer vaccine. When you give a vaccine, there is a powder or vaccine in one vial, and you dilute it with a solution to mix it up. And what people have been finding with the formula that was given by Pfizer is they anticipated getting 5 doses, oftentimes get a 6th dose out of the vial. And so contact was made with the FDA and with Pfizer to see if that was legitimate, that that vaccinators pull that 6th dose out of the vial. And news was given to us all last week that indeed was legitimate if you could get a full 6th dose to go ahead and use it. They have said don't try to keep a little from this vial and a little from this vial and a little from this vial and mix them all together because that becomes unsafe for infection control reasons. So that is good news. We're actually getting a little bit more vaccine in the state than we thought. And for the last part of your question about the differences between the Pfizer vaccine and the Moderna vaccine, I'm going to turn to Tom to talk about that.
Sure, I can explain a little bit about the similarities and the differences between the two vaccines. As Brittany just mentioned, the two vaccines that are out right now are called mRNA vaccines, messenger RNA. And what that means is the vaccination itself instructs the cells of the body to make harmless spike proteins. Spike proteins are what normally are on the outside of the COVID virus, the SARS-2 virus. So that is what enables them to go into a body, into the cells of a body. So what it is again just a spike protein that's produced, which produces the immune status and the antibodies. A couple of differences between the two, as has been mentioned earlier. Pfizer has to be kept at sub temperatures at 94 degrees Fahrenheit below zero. Moderna -4. Once thawed, Pfizer should be used within 5 days, where Moderna can be up to. As far as the dosage and administration, they both are 2-shot regimens. Pfizer 21 days after the first shot, Moderna 28 days after the first shot. Those are not set in stone. There is a bit of a grace period, a couple days before, a couple days after, but we want people to try to really do the best they can to stay on their schedule and make sure that they get the same vaccine. As I said, they're not interchangeable. Again, with Pfizer, it's 16 and up, age 16 and up, and Moderna, 18 and over.
Thank you for that. Let's go now for our next question to Todd Richmond at the Associated Press. Todd Richmond.
Hi there. Julie, I'm wondering if you might be able to just go over the Pfizer dosage situation again with the 50,000 versus now the 35,000 dose that we're going to get. My initial understanding was we get 50,000 and then a second shipment of 50,000. Now we're getting 50,000 and then 35,000. Is that correct?
That is absolutely correct, Todd. And your understanding that we were going to get 50,000 and then 50,000 was our understanding as well, too. That was the data that was included in the Tiberius system for Wisconsin to plan from. And as we learned last week, there were, I'll let the federal government explain exactly what happened, but apparently there were, those were planning numbers, not actual numbers, and they failed to be updated. So, so we're adapting, and we understand 35,000 is more similar to what the weekly cadence will be for the next few weeks, and we've been told it will adjust again sometime in January. So, you know, this is a really important piece because I know everyone wants to know, when will we be done with phase 1A? When will we go to phase 1B? When will we go to phase 1C? And when I think of this, it's like a three-legged stool. In order for us to get Wisconsinites fully vaccinated, first of all, one leg is we need people who want the vaccine. And I think the good news here is we're hearing from our healthcare providers they want it. We're hearing from the public they're eager for us to move through the phases so they can get it. And so I think people are seeing our healthcare workers raise their hand and say, we want to volunteer and we want to go first. And that's instilling great public confidence in this vaccine. Second, we need to have a system for delivering the vaccine, which, as we've been talking about, we're continuing to expand and build upon, beginning with our healthcare system, and in the next few weeks, starting to launch providers who can give vaccine out in the community as well. And then third, we need enough vaccine, and that goes to your question. And so we could have all the demand and we could have the best system in the world, and if we're still only getting 35,000 doses a week, and we've heard we're not going to get 100,000 Moderna next week either, we're going to get a smaller allotment. That's not going to go very far to get us to, you know, remember, if every Wisconsinite gets this vaccine and it's 2 doses, we need 11.6 million doses. So we need all 3 elements, and we're looking to the federal government to help us understand how quickly our doses will increase so that we can provide better predictions about when we'll get through each of these phases, and people in Wisconsin can estimate when they might be eligible to get vaccine.
Thank you for that. Let's go now to Stephanie Hoff, WisPolitics.
Good afternoon. Thanks for taking my call today. I just want to
clarify that 10,358 Pfizer doses have been administered to date. And then just to clarify that that's correct. And then when do you estimate the first Moderna vaccines will get into people's arms?
So you are correct. 10,358 as of a report run earlier this morning. I can assure you, Sophie, that there are far more vaccines that have been delivered since that report was given. And I think that's the interesting thing about reporting on vaccines. We'll give you point in time, but I can assure you that there are vaccines being given as we speak. In terms of the Moderna vaccine, I have not heard confirmation that it's arrived in the state yet today, but I anticipate if it has, that those receiving it are going to be eager to start giving vaccine. There may be some doses given yet today. And as more and more arrives Tuesday and Wednesday, even more doses administered going forward.
Thank you. We go now to Seneca Barta, WMTV in Madison.
Hi, can you guys hear me?
Yes, we can.
Perfect. Earlier this week, the CDC did release some guidance on who might be considered essential frontline workers, like first responders, people in the education sector. Is that guidance that Wisconsin will be following once it moves past this first phase of 1A?
So that will certainly be guidance we'll take into account. As we did with phase 1A, as we define who will be which subcategories of those frontline workers will be prioritized for phase 1B. We'll be working both with the ongoing guidance that CDC through their Advisory Committee on Immunization Practice provides, and the counsel of our own state's State Disaster Medical Advisory Committee. That committee is composed of healthcare practitioners from a variety of disciplines, from ethicists, and they have been advising us throughout the pandemic. They look at all of the research and the evidence and weigh different ethical principles and provide a recommendation to the secretary, who then works with the governor to make final decisions on who will receive that vaccine. Or which group will be prioritized for that vaccine in Group 1B. So that work is yet to come. I think I'll say one more thing about this. As you think about this, they're weighing different principles, right? They have to weigh, first of all, what's in the emergency use authorization. So for example, they're not going to say give it to children, because emergency use authorization doesn't allow for administration of the vaccine to children. They then look at which group is most at risk for transmission of COVID-19 and severe illness and death, or morbidity and mortality. That's one principle. Another principle then they look at is related to how disruptive to society and the economy might it be not to immunize this group early. You know, who needs to be immunized and protected, because we need core functions of society continuing to function. And then lastly, they think about equity, who has been most disproportionately affected by this virus, and especially who has perished from it. So if you think about Group 1A, it was one group that we clearly included because of their higher risk for severe illness and death. That's people who live in long-term care facilities. And it was one group that is clearly important for us to continue to have a strong societal response to this, our healthcare workers. Now, in that case, many healthcare workers who are working directly with people with COVID are also at increased risk of infection. So it's balancing these two. And I think as we move forward, the committees will continue to think about how to balance those different principles.
Good information. Thank you. Now to Mary Jo Ola, TMJ4 in Milwaukee.
Hello, it's Rachel in for Mary Jo. Wondering about doses coming in today. Did those include the second round of doses already? Or like, how can you assure that the people who are getting doses now or vaccinations now will have the second round, 28, 30 days from now?
That is a great question, Rachel. And so how the federal government has described how they're handling this is the doses they're sending to us right now are dose ones. And so when they sent us 49,738 or 725 doses last week, they held back 49,725 Pfizer vaccine earmarked for Wisconsin that they will send to us, I would assume, 3 weeks from week one. So they're sending this 35,100 they're sending this week. They've got 35,100 held back for the people who will receive those doses for dose 2. So every initial dose they send to us, there is a second dose held back that will be ready to send. And that way, we avoid the situation where if the 49,000 was dose 1 and dose 2, and we gave it to everybody, and then 3 weeks from now we only had 35,000, we'd be sitting with, a group of people who wouldn't have access to dose 2. But the federal government has accounted for that and how they plan to send the future vaccine.
Thank you. Let's go now to Denise Lockwood, Racine County Eye.
Hi, thanks for taking my call. My question is around the monoclonal antibodies. And what I'm wanting to find out is to understand what your hope is with regards to mitigating the number of people who are going to the hospital. What would that look like as far as success for you guys? But also trying to understand kind of how that fits into the overall strategy around managing the cases.
Yeah, great question. So as we think about COVID infection and how we stop the spread and stop the surge in our hospital systems, there's several things we can do. One is the preventive mechanisms we can do that we talk about all the time. Wearing our masks, limiting social interaction, avoiding mass gatherings, washing our hands, all of those things. Then the second thing you can do is how do we improve treatment for people with COVID infection? And I think one of the things about the monoclonal antibodies is it's one of the first treatments we have that is for early in disease and that is intended to decrease more severe illness. We've had treatment like this for years with influenza. It's called Tamiflu. If you're diagnosed early in your illness and you get Tamiflu, which is an antiviral medication, you're much less likely to have severe illness or hospitalization or death. Now, the two medications work very, very differently, and the monoclonal antibodies are clearly under an emergency use authorization. We're still learning more about them, but it's the same principle. Use this medication to stimulate the immune response against COVID-19, and the early research shows a reduction then in those folks entering the hospital. It is targeted to groups of people who are highest risk for more severe illness and hospitalization. So it's a second way we work to both reduce severe illness, to reduce death, and to reduce that demand for hospital services that we were so perilously close to overwhelming a few weeks ago. And then, of course, the third arm of how we reduce the number of diseases is through prevention through vaccine, which we are working on right now. So monoclonal antibodies are the first medication for giving before people get into the hospital. There's also been other medications and other treatments that we've learned about since early in the pandemic that have helped people who are hospitalized, like the drug remdesivir. Like, we've learned a lot about how to manage oxygen therapy and ventilators and positioning and a variety of other non-pharmaceutical ways of treating the illness. So it's both how you manage the illness how you prevent it, how you manage it, and then finally how you prevent it through vaccination. Hope that's
Thank
helpful.
you. Good answer. Thank you. Amanda Quintana, News 3, Madison. Amanda at News 3 in Madison. All right, we'll try to get back to Amanda, and let's go now to Chuck Kornbach, Milwaukee Public Radio. Chuck?
Good afternoon. I also on the infusion clinic, a question or two. Most importantly, could you pronounce the name of the drug? And then second of all, the Medical College of Wisconsin has been recruiting people to come take it there. How much coordination is with the Medical College, and how many other healthcare systems or maybe around the state are offering this drug as well?
All right, Tom, can you say BAM?
Actually, Julie, that's exactly what we say is BAM, because we kind of gave up on the pronunciation on that, but we all know what each other's talking about. I'd have to look it up too, and I've heard so many different pronunciations of that. So, yeah.
Something like BAM live in the mob, but I'm not sure I have it exactly right. We just call it BAM for short. And then there's a second one called Regeneron, and that's a brand name from the pharmaceutical company. They're two different manufacturers. Yes, this is one additional option. Certainly health systems around the state have been receiving this treatment for a number of weeks. Once it received its emergency use authorization, the federal government had a contract in place to purchase this drug and began distributing it to states. And we have an active system of survey and interaction with health systems across the state. And so again, our SDMAC provided guidance on how to distribute it across the state, because you have to pre-position it because of what I said about wanting to give it to people early in their illness. And so we've positioned it at various hospitals across the state to be available to patients as they require it. And so this is one additional opportunity, but clearly throughout the state, we know this drug has been administered in emergency rooms, in modifications of infusion clinics, in exam rooms, in clinics. So there's a variety of different locations within health systems it's been administered and is being put to good use.
Thank you. Now to Derica Williams, Fox 6 Milwaukee.
Hi, thanks for taking my question. I just wanted to talk about the reactions out of those 10,000 plus doses that have already been given. Did we give that number of the reactions? And also, is there kind of concern that we're just kind of getting kickstarted with this, but talks of the coronavirus kind of mutating and what that means for immunity and just kind of starting us all again?
Are you referring to allergic reactions?
Yeah.
Yeah.
And what are those symptoms that people are finding?
Yeah. So what the biggest concern is that you've heard reported are when people have an anaphylactic reaction, and that is an allergic reaction that goes system-wide of your body and can make it very difficult for you to breathe and have other systemic effects. To the best of my knowledge, we have had no anaphylactic responses here in Wisconsin. Tom, can you confirm that?
Yes, I can confirm that. It's in just looking at the Pfizer complications list, they're finding that most people will wind up with a sore arm, some fatigue and headache, especially after like the second shot. It's much more common than the first shot. But we are really concerned mostly with the severe reactions, the anaphylactic shocks, where you cannot breathe and you require medical attention very quickly. And that is monitored through a national system called the Vaccine Adverse Reaction System. And it's nothing that we've heard of so far. We heard that there may have been a few cases nationwide in the clinical trials, but nothing in Wisconsin at this particular time.
CDC just reported on anaphylactic response as well too. And so at the point in time, we had administered 272,000 doses across the state. There were reports of 6 cases of anaphylaxis. All of them were treated on site with the appropriate medications that are present at every single clinic, and all of the patients have survived and are recovering. So this is a risk anytime you inject a medication into the body, especially a new medication. And so CDC, again, this week has issued additional guidance around anaphylaxis and allergic reaction, how much, which it's epinephrine or what you carry in an EpiPen. We always have that medication available at any immunization clinic because this could happen with any vaccine. And they're just providing additional guidance about how much of that medication to have, any other emergency support services that you need to have. You need to have easy access to medical care for this. We are assuring those kinds of safety mechanisms are in place. In terms of mutation of the virus, that is something we'll be watching. And what I understand from the reports coming out of the UK is it has mutated in a way that makes it more easily transmissible or more effective in its transmission. We do not yet know if that would have any effect on whether the vaccine will continue to be a good match for it or not. It is entirely possible that this vaccine will still be effective because the basic composition of the virus, again, with the spike protein as part of the virus and the way this virus is manufactured, will continue to be effective.
Julie, if I could just add to that as well. They're still trying to determine in the United Kingdom exactly if this has become the predominant virus, the mutated virus. They haven't made that decision yet. What I heard on reports as well is they don't think it is any more lethal than the original one, the mutated coronavirus, but there's still a lot of studies that need to be done. And that virus has not yet been identified in the United States at this particular point. But we have to keep in mind that this is an RNA virus, and RNA viruses tend to mutate. Another perfect example is your influenza virus. It tends to mutate little by little, which is why we have to get our annual vaccinations.
Thank you, Tom.
Thank you both. Let's take the next question from Sarah McGrew, WAOW in Wausau.
Hi, thanks for doing this call. You guys actually just answered my question in your last response, so I'm good. Thank you so much.
Great, thank you.
Thank you. Let's move on to Dan Malloy, Spectrum News 1.
Hi there. This is just a question about the numbers. We now know more than 10,000 people got vaccinated in the first week. I'm just wondering kind of what factors into the decision of publishing this data, and what are the benefits of making these numbers public?
Yeah, thanks, Dan. We're getting ready to publish data, and beginning next week, you'll see data on our website about vaccine numbers. And as more and more people are vaccinated and we have a more representative sample across the state, we'll begin to provide additional demographic data like we do with a variety of other indicators of the state of the pandemic, like our cases and deaths. So thank you for that question. And I should have mentioned that earlier. Beginning the next week, you'll start to see a page with publicly available data.
Thank you. Next question to Francisco Almanara, WKOW.
Hi there. Can you guys hear me okay?
Absolutely, yes.
Great. So I would just like to see if you guys can talk a little bit more about not specifically the mutation that we're seeing in the UK, but just mutations in general, and how effective not only the vaccine will be in the future if we see more different types of mutations here in either Wisconsin or the United States, but also how the antibody infusion that was mentioned before would be affected by any form of mutations that we are experiencing.
Great, and I'm going to turn to the research scientist, Mr. Tom Haupt, for that.
Yes. Well, first part of the question had to do with how will it, basically, is it going to be, the vaccine going to be effective if we have mutations? And I think Julie mentioned earlier that the mutations many times are very small. And they will always offer some kind of protection with the vaccine that you currently have. But I can kind of foresee that this vaccine might be something that's changed on an annual basis. I don't think that's been decided yet, whether it's going to be a one-time thing or if it's going to be annual. But based on the fact that this virus is mutating, that may very well be the case. It really depends. I mean, there's just so much that has to be learned about this virus at this particular point. But I don't want people to start thinking, hey, the virus, that the vaccine is not going to be effective because of this mutation. More than likely, there will be some, if not a lot of protection based on this, but on the preliminary information that we've had. I don't know exactly how it would affect the infusion instance. Julie, I don't know if you have any thoughts on that. And again, that's putting antibodies into the body. I don't know what the answer to that one is. I'm sorry.
Yeah. I think I would just reemphasize what Tom said is this is the puzzle that a pandemic with a novel virus presents to us, is that we will need to continue to study and to evaluate each treatment modality and our vaccines as we move through. We have approved these drugs and the vaccines on strong clinical trials with thousands of people in them, but they're still fairly recent. We don't have longitudinal data on any of this. And so even before people were thinking actively about mutation of the virus, we didn't know if this virus would require an annual shot or a periodic booster shot like you get with your tetanus series. And so these are all questions that will be answered as additional studies are underway and we learn more. And what I can assure you is there are, it isn't like one and done. You did the clinical trial for the vaccine, you got your emergency use authorization and you're done. The manufacturers are continuing to study their phase 3 clinical trial populations over the next several years to monitor for any side effects and ongoing evaluation of those patients. And there are additional studies being done related to vaccine and other medications and transmission and mutation that will help us continue to learn about this virus.
Thank you for that. Let's give the next question to Kimberly Shine of Telemundo. Kimberly Shine, Telemundo. A reminder to *6 will mute and unmute your phone. And we'll move on to Nick Ford, WISN Milwaukee. Nick.
Good afternoon. Good afternoon. What can you tell us about the app for the alert app when you test positive? We mentioned last week that was coming. It would be activated, and there'd be more information this week. What can you tell us about that? And have you talked to other states about how well theirs is working or isn't?
Yep. So we anticipate that app will be turned on later this week. I'm not sure exactly what date, Wednesday or Thursday. And my understanding is that people will receive a notification if you have a smartphone, and you can choose to opt in or opt out. And I, of course, encourage you all to opt in. So again, what the app does is that it uses Bluetooth technology to determine if you have been in touch Bluetooth to Bluetooth with another phone. And if you test positive, you're asked to put a code into your phone that will indicate that you have tested positive. Then that will send a message to other phones that have been within 6 feet of you for more than 15 minutes to say that you may have been a close contact to someone who tested positive for COVID-19. It does not send any identifying information, so it's not going to say you were exposed to Julie. It will just say the Bluetooth technology indicates that you may have been in contact with someone, and then we'll provide you with instructions about what you should do about testing and quarantine. We have talked with several other states who have this, and we know based on some changes in the technology, a number of other states are launching along with us in this week or two because it was a very opportune time to do it. So we'll see, we'll also all learn together. I think the key to a technology like this, and we've heard this from other states, is that it depends on how many people use it. And so it's kind of like vaccine. The more people that buy in and say, I want to be part of this community to help notify my neighbors and friends, the better. And the second thing we've learned is because if you test positive, you do have to take an action to put a code in your phone that will then make your Bluetooth technology say, communicate I was infected. That is really key. And one of the technologies we wanted to wait for, which is why we're launching now with these other states, is that will be automatically generated and sent to your phone from the positive lab test. And all you have to do is click yes, and it's done. States before us were having to call people and tell them to put a code in. And we know that the more work anything is for anybody, the less likely we are to do it. And so the system has gotten really sophisticated, really easy to opt in, really easy to report your results. And we just encourage people to be part of the community of helping everybody know when they may have been exposed so they can take appropriate protective action. And it'll be another tool to reducing the spread of COVID-19 in our state.
Thank you. Let's go now to Mitchell Schmidt, Wisconsin State Journal. Mitch Schmidt.
Yeah, thank you very much for the time today. So you talked a little bit, and so we've seen daily vaccinations have been going up since that first shipment was received, and it sounds like you guys are through about 1/5 of that original shipment. I'm just kind of curious if you could talk a little bit. Do you guys expect to see daily vaccinations to continue to increase? And then along those lines, is there a scenario where the state is limited on its daily vaccination efforts directly related to the number of vaccines that you guys are receiving from the federal government? Thank you.
Yeah, Mitch, we absolutely have seen exactly what you said. Every day vaccinations growing, and they're going to grow even more over the next few weeks because, as I said, we're getting the vaccines to more and more providers. So that will contribute to greater growth as well. And absolutely, yes, we run the risk of being limited by the number of vaccines that we have available. And so it isn't, I think we're going to have enough vaccine to get through phase 1 at, if we're looking more at 30 or 50,000 doses a week than 100 or 150,000 doses a week, it's going to take us longer, right? So it really goes to the cadence of how quickly we can move forward. We know there's somewhere between 400,000 and 450,000 healthcare workers in our state. So, at 10,000 doses a week, it would take a long time to get through, but we're going to get a lot more doses very, very quickly. I think the bigger issue is when we open this up to larger populations, that's where we're going to run into issues if we're not getting significantly higher numbers of doses from the federal government. It'll take us even longer. So just to give you a sense, the estimate of the frontline essential workers is a little more than double the estimate of the number of healthcare workers in the country. So phase 1B, as it stands right now, is over double the number of people eligible than we have here in phase 1A. So if we're getting the same amount of vaccine, that's not going to go nearly as far when you have twice as many people who are eligible to receive it.
Thank you for that. Next question to Colin Wood, Scoop News Group. Colin Wood. And *6 will unmute your phone. All right. Jonathan Neiser, NBC 26.
Yes, thanks for the opportunity for a question. I know you're just addressing the numbers of vaccine coming, but regarding the number of vaccine that is here and in the state, that first batch from the Pfizer, and I know you said there's more going in the arms probably as we speak, but why would we only be at 20% at this rate? It's going to take 4 weeks to get through that initial batch. So where is the urgency, I guess?
Well, the urgency is balanced with the safety. And so I want to go back to the history we talked about earlier. When we got those first doses a week ago, the ink was barely dry on the paper of what the appropriate use of this vaccine was around solidifying all of the storage requirements. And so that's not how we usually bring a new medication or a new vaccine into the world, is that we start administering it within 48 hours of its approval. There's a period of time for people to learn about it, to understand its implications. Now we're doing all of that. I don't want to have people think we're not doing that, but we're doing it. I mean, I think the fact that we're doing it within 48, 72 hours, 1 week, that we've had 10,000 doses given is really incredible when you think about how brand spanking new this is and how we didn't have the final guidance until last weekend. The second thing I want to just emphasize is that again, we've talked about how fragile this vaccine is. And so if people are just willy-nilly or haphazard with it and haven't read the instructions about how long it can be out of the refrigerator or the freezer and still be viable, and how you properly mix it and reconstitute it, and how you properly extract it from the vial, you will be giving ineffective doses. And, you know, we could have given 49,000 and have half of them not be valid, and we'd be in way worse shape. So I want to give a big shout out to our healthcare providers who have been learning like this and have been setting up clinics and have been getting ready to roll. And I can assure you, you are very quickly going to start to see rising numbers of vaccination. But the intent was never that we'd be able to give 49,000 doses in the first week. It was that we would have those doses available so that people know they can plan to give them in the subsequent days. Because the other thing is you can't set up a vaccination clinic and schedule people until you know how much you're getting. And that has all been a process over the last week or two as well. So many different moving parts on this. Over the next few weeks, we'll start to hit a rhythm of getting those moving parts going in the healthcare system. And then we'll start to do that, getting rhythm going in more community-based systems as we move into vaccinating broader populations. And we will increase the number of people vaccinated each week as we move through these different portions of system setup.
Thank you for that. The final question to Ryan Wallersheim, WORT in Madison.
Can you hear me?
Yes, we can hear you.
Okay, so my question was, how long was the phase 1A process initially expected to take, given the federal government's previous projection of about 50,000 weekly doses? And also, what is the communication process with the federal government been like over the course of this fluid distribution and planning process?
Well, if we'd gotten 50,000 doses a week, first doses a week, it would have taken 9 to 10 weeks to do all of phase 1A. And if we get more and we have an effective delivery system, it'll take less. If we get less, it'll take longer. I will say the federal government has been very responsive. We have been in regular contact with them. We have, when we've had concerns, we have had people from HHS and CDC very responsive to us. And, you know, as we've said, it's a complex system and we are learning as we go. And I really believe as we get a few weeks into this, things will stabilize and we'll hit a rhythm of regular understanding of what's coming from the federal government and an ability to be more planful within our state in a more predictable way, to continue to get these vaccines in the arms of Wisconsinites to protect them.
Thank you for that. And with that, we will wrap up today's briefing. We want to thank the Deputy Secretary and Tom Haupt for participating, as well as all of you. And we remind you to continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.